Hey, it's Pam from Ben McFuzzylugs again. So today's dog training tips is if your dog's behaviour changes suddenly, visit the vet. So, me back again at the end of a lovely day, as I got a good response from sticking up some of my snaps yesterday. Rather than look at my ugly mug, I'll stick up a couple of pictures for you guys again today of my beautiful walk. It's Mother's Day in the UK and fantastically sunny day, so I was really surprised to be able to find a lovely walk where I wasn't surrounded by people. It's nice to get out somewhere peaceful, walk the dogs without having to deal with hundreds of folk. So if this is your first time, thank you so much for visiting. I'm making a dog training tips video a day for the month of March. We're actually nearly through that, so if you want to have a wee look, you'll maybe get some of my old videos. I hope they're interesting. I also do Thursday needle felting tutorials and Monday tips and tricks on growing your Etsy business for a small crafter. So if you're interested in any of that, please hit subscribe and come back. And come back for any of them, please. So for today, we've talked a lot about different training methods and things with dogs. But what we haven't talked about is sometimes it's not a behavioural problem you're dealing with, it might be a medical problem. So if you see a big change in your dog's behaviour, an unexpected change, then rather than trying to train them for the behaviour, first of all check what's going on. So let's think about the age first of all. So if your dog's been absolutely perfect, doing everything you want, and then suddenly they hit about 6 to 8 months of age and it's like they've never been trained, they're an absolute nightmare. Firstly, don't stress. This is the terrible teens. Quite a lot of dogs go through this. It's kind of normal. And I've seen studies, I haven't looked into it too much in depth, but I've seen studies that suggest what might be happening is you might be at an age where their brain's developing quite quickly. So actually all the nutrition and the food and everything is going to this developing brain, and they really actually can't focus so well. It's not actually their fault. I've heard good reports, people who put little supplemental extras in the dog's food like oily fish or fish oils or something just to help with that brain development. But basically at this stage, if you're seeing a big change in your dog's behaviour, just go back. Just go back to the beginning, treat your dog as if it's never had any kind of training at all. Just start at the start, make it dead easy for them. Don't tell them off if they can't focus, it really isn't their fault. It's just their age. And if you start nice and slowly, teach them kindly and everything, they'll remember again in no time. But just be aware, things like your recall and everything could totally go out the window. So go safe places and work with what you've got. Another thing that can happen, especially with something like not being able to focus, a bit of hyperactivity, think if you've maybe changed the food. I'm not going to name names or anything, I don't want to get sued on YouTube, but there are certain brands of food that people think are good quality, but they're not necessarily. They might advertise quite a lot, but that's what the price of the brand is. You're paying for the advertisement, and they're actually not a great quality food. They have lots of E-numbers and things in them, and just like some children can be sensitive to certain E-numbers, it seems that some dogs can be as well. Could be the E-numbers, it could be some of the other ingredients in the food, but quite often when you see a dog that can't focus and has that kind of hyperactivity, just they're not bad, but they just can't seem to focus like you think they should. That's more often than not, they're on one or two particular brands of food. So just see if you've recently changed your dog's food, or even look if the manufacturers maybe changed some of the ingredients or something, but check and see if there's a whole load of E-numbers or a whole load of like sugary ingredients and things. Dogs do not need sugar. So basically some foods are like feeding your dog Smarties. it's not the best, and possibly if you change them onto a better quality of food. Now, better quality doesn't necessarily mean it's more expensive. It could just be a product that's not so heavily advertised. There's quite a lot of good brands about. If you have a look, things like the first ingredients should be actual meat rather than filler, corn, beet pulp, all these kind of things. So just have a really good look at the food. And so for anything else that's an actual change in your dog's behaviour, get them to the vet just to make sure. All sorts of medical conditions, which might not be that serious but might be causing some slight problems. Anything from a small pain, pulled a muscle, or hip dysplasia. Any kind of pain somewhere could be causing the dog to be more grumpy and less tolerant. Skin irritation. I was surprised to find out actually that dogs get things like hay fever. You know, they have allergies at different times of the year. So if the dog's got an allergy, that might be bothering them a bit. If they're losing their sight or losing their hearing, that might make them less confident and possibly less tolerant to things. If you think something like pain could make them more grumpy when they fear they might be getting bumped into, they might be starting to get grumpy around children or puppies or anyone that moves a bit clumsily. Also, if a dog has pain, they can actually start cleaning, can start licking a lot, not even necessarily in the place where the pain is, can be a referred pain, and they'll lick about somewhere else. So just look for changes in your dog's behaviour that aren't normal. If in doubt, just get them down to the vets to get them checked out. Other things like thyroid problems, or blood, things that can be found with a simple blood test could be causing aggression problems or all sorts of problems. Get yourself down to the vet before you start any kind of program of behavioural work, most especially for a change in behaviour, because that is more likely to have been an illness-related problem. If something changes, that's going to be a medical problem probably more than a behavioural problem. So get them checked out first and then figure out what you're going to do about it. Okay, I hope that helps. I hope you enjoyed my pictures of my walk today as well. If you like that, please come back again. Give us a like, subscribe, and let's see what we talk about tomorrow. Thank you.